Exactly. So once again, as I said earlier, we are about to start, and this is the third day of our 12th batch of online masterclass, whereby we acquire safety knowledge. We are very happy that during day one, we study about the foundation of occupational health and safety, which is the segment on which we can lay our own groundwork. Yesterday, all of you were amazed by the teaching method of our expert, one of our leading experts among us, Madam Els. She drives us through safety knowledge, safety culture. Now, sorry, today is the third day, and I promise you that you will really gonna enjoy it as well. Today's course is course number 103. Course number 103. If you pay careful attention to this course, it will help you to understand some of the following courses that you follow, namely course 105, course 106, and course 109, even course 103. This course is going to help us to see what management system we can put in place and who are the people involved. Well, I'm not the trainer, but among our team, we are fighting. Generally, we are promoting gender equality, and among our team, we have experts from different levels as well. Tonight's trainer is coming directly from Tanzania, and she is Mrs. Pudensiana Paul. Mrs. Pudensiana Paul is a health and safety and environment specialist for over 5 good years, and she holds a degree in environmental science and management from Adi University, that is in Tanzania. During the course of years, she has participated in different researches, especially on waste management, namely like WAFH projects. She has also been monitoring and evaluating projects at field supervisor. She has the privilege for working with electrical contracting company as safety, health, environmental, and quality consult officers by implementing client health and safety project requirements with big clients like Vodacom Tanzania, Total Energy. We know Total Energy is a worldwide brand. She has also got experience in project tendering, submitting health, safety, and environment document requiring for tendering. From her experiences, she can be able to make a preparation of health and safety environment documentation as per standard. She is also a lead in implementation of this documentation and maintain a safety culture in pharmaceutical industry. So out of her experiences, we all gonna benefit tonight. Therefore, if you are online, kindly mute your microphone to avoid background noise. Also remember the few best practices: having a cup of water with you, always make a body movement to avoid ergonomic related problem. On this note, I would kindly like to invite Mrs. Pudensiana Paul. Pudensiana, you have the floor.
Hi everyone.
Yeah, good evening.
Good evening. How are you?
Yeah, I'm fine. I presume that we are all fine.
Yes, thank you so much for this wonderful opportunity that you have given me. Actually, I'm so excited to be in here. And sorry, Mr. Rion, can you please display my presentation?
Yes, please.
Okay, so that we can start right away.
Yeah, here it is.
Yeah, that's my face, if you can see on the presentation. Thank you so much, students. I can see we have a number of 13 students in the class. I think we can proceed. Others will find us on the way. I'm going to present on healthy safety and management system. Can you go on the next slide, please? Mr. Leon? Yes. I'll start with the introduction. When we speak of healthy and safety management system, what do we mean? This term can be defined in different ways, but I've tried to define it in at least four ways. The first term, the first way of defining a health and safety management system means health and safety, work organization, and policy in any company or any organization. That's one way how you can define health and safety management system. But another way, you can define it as a planning process for accident and ill health prevention. If you have a plan or you have a process for incident, for accident or ill health prevention in your company or organization, that means it's a health and safety management system. Or in another way, you can define it as the practices, procedures, resources for developing, implementing, reviewing, and maintaining occupational safety and healthy policy. So when you talk about practices in place in the company organization, talk of procedures, talk of resources for developing, implementing, reviewing, maintaining. Now maintaining what? Maintaining the occupational safety and health policy in the company. That's what we call a health and safety management system. But in another way, you can define it as a line management responsibility. So as you move on, you can see everything that is defined here. We are going to discuss it in detail. So you're going to know what is health, safety. You're going to understand what are the processes involved. You're going to understand what are the practices, procedures, how you can develop or implement, review, and maintain all those occupational and safety management system. Next. Yes. Now, when we talk about health and safety management system, we have purposes. Why should we have health and safety management system in the company? Or maybe I can say, why health and safety management system? So these are the answers of the purposes or the advantages of having the health and safety management system in any company or any organization. First of all, if you take an organization which has a health and safety management system in place and the one which does not have the health and safety management system in place, these two things are different. So if you find any company that is having health and safety management system in place and implementing it, these are the advantages that they can be getting. If you have health and safety management system in place, it means it can help you, or it can help an organization to identify hazards and minimize risk. As we know that in any company, in any workplace, there are different hazards that are that are in place due to the activities or due to the activities or operations that are taking place. So having health and safety management system in place, it will help to identify hazards and minimize risk. But another advantage, another purpose of having health and safety management system in place is to make sure that we have a safe working environment. If you don't have a system, a health and safety management system, it is very difficult to have a safe working environment. Another thing, through health and safety management system, it is very easy to define roles and responsibilities from the management, from the top management to the lower levels, the normal workers. Through health and safety management system, you can define roles. What are the responsibilities of the management on health and safety management system? What are the responsibilities of normal workers, either permanently employed or casual workers? So through health and safety management system, you can define this very well. But having health and safety management system in place, it is very, very easy to report incidents and having a mechanism of reporting them, recording them, and do investigation. That's now further procedure if we have big, I mean, maybe high potential incidents. So having this health and safety management system, it will help the organization, the company, to have incident reporting procedures and recording mechanism. But another thing is that, as we know that having health and safety management system in place, it has two advantages. Mostly two, I mean, I can explain at least mainly two. First of all, it can help to reduce accidents within the organization or the company. So by reducing the accidents can happen maybe to the workers or to the properties that we have within the company. So if we have health and safety management system in place, it means it can help to reduce losses of properties and also losses of people. But we have key elements of occupational health and safety management system. When you talk about health and safety management system, you cannot leave away policy, organizing, planning and implementation, evaluation, or another way you can say it as a measuring performance, reviewing performance, auditing, and actions for improvement. I'm going to explain each and every term here. When you talk about policy, it means through policy development, you can be able to give direction and set priorities. It means through policy, it means the company or an organization states its commitment on how it can do on implementing health and safety management system. So having a policy in place, it means it helps to give directions and set priorities. But on the part of organizing, when you say organizing, it means it's all about organizational development. So having an organizational development, it means it's through communication, roles and responsibilities. So through organizing is now, if some companies, they have this what we call the organogram. So if you have the organogram, it means it explains, it shows the structure of the organization, but also it through the structure you can know the roles of each and every person within the organization or the company. But coming on the planning and implementation, now on planning and implementation, it means after planning, then there is an assessment. So you cannot only plan, but you also need to do an assessment. The next the next element is the evaluation or measuring performance. After you have a policy in place, you have done the organization development. Now you have to do the evaluation. You have to measure that the procedures that are in place, are they working properly? Are they only written on papers, or they are practical within the organization? So on this part, on the measuring and the performance, you can evaluate, you can check, you can weigh your procedures if they are well understood, or they are only written on papers. Yes. Then on the next thing is the reviewing the performance. Through the way of reviewing performance, you can check if you have the health and safety maybe officer, or you have given some roles, different roles to as per organogram. It means through reviewing performance, is the way of measuring what we call KPI, yes, key performance indicators. So through this reviewing performance, you can check if that person who has been given the authority or the mandate to implement or to supervise, make sure that the health and safety of a certain company or organization is well implemented, you can check the key performance indicators. But another thing is the audit. Now, on audit, we just check the whole process, the procedures, the policies, everything that is in place concerning health and safety management system. It has to be audited. And on the part of audit, there are two types. So two ways of doing an audit, what we call internal audit and external audit. Internal audit, it can be done within the organization, that you have auditors among yourselves. maybe one department can go to audit another department, but external audit, it means you bring other people apart from your organization. They come and check all the procedures that you have in place. And last, after audit, they normally give out the findings that you have checked this and this, maybe it is not doing good or what, then you have to put the action plan for the improvement. Are we together, class?
Yes, please.
Go ahead.
Am I too fast?
Yes. But I think you're okay.
I'm okay. Yes, now can we move on the next slide, please?
Understood.
Yes, I think I've explained on the policy and commitments. So now on the policy and commitment, the company has to prepare a occupational health and safety policy program, the commitment to continuous improvement. Now on the continuous improvement is where we see reviewing, audit, all this falls on the continuous improvement. And also within the policy, it has to define clearly the responsibilities to people and the working environment from the top management to the workers. But also the policy must be cost effective. This is a challenge, I think, of the most many of the companies, because health and safety is something that is adding on the it has on the companies, it has an implication on the costs of the company, and it's something that seems like it has no direct it does not bring direct profit to the company. So if you're not very keen on this part, you will face so many challenges on implementing the policy. That's why it is very, very important to make sure that when developing any health and safety management system, the management has to be involved. Why the management? Because the management are the main key players to make sure that the health and safety management system can be implemented 100%. So in developing any policy, it must be cost effective. It must be cost effective so that it can help in reducing financial losses and liabilities. But also it has to state target group like stakeholders, expectations, visitors, contractors, and customers, that through our occupational health and safety policy, we will be able, we are committed to do so and so to our customers, to do so and so to our visitors, to do so and so to our contractors. Yes, so it has to touch those parts. Next, please. Yeah, on organizing, as I've explained, it has to state like positive safety culture, participation at all levels. If you clearly define the organogram of the company, it will be very, very easy to explain the roles and responsibilities of everyone from the top management to the lower level. And also through organizing, this is the very, very key part. You cannot implement any health and safety management system without communication. When I say communication, what do I mean? Any health and safety management system in any company or in any organization, it has to make sure that does not rely only on the management, or the way it has to balance. So there must be a balance, that the information that the management has is it the same information that the normal worker, I mean the lowest person level in the company or in the organization, does he have the same information? So we need to make sure that on the part of organizing, from the top management to the lowest level, they have the access to all occupational health and safety, all occupational health and safety informations. They should balance. So from the lowest level to the top management, because the management, they are the main key player because they are the owners of the company. But the workers, they are the ones who are exposed to to hazards every day. You can take an example. Maybe the CEO is sitting in the office from morning to evening, but a normal operator who is working with the machines is exposed to high risk, is in a high risk. So through communication, the normal worker, she or he has to get proper information, and he must have access of health and safety informations. Can we go on the next, please? Yeah, so on planning and implementation is now you can formulate a plan to fulfill its occupational health and safety policy. But also a company must develop occupational health and safety objectives and targets. And all these, they should be set to all managers and employees. You can see it starts from top management. When we say managers, these are very, very key people. I mean, they're very important people in making sure that the health and safety management system is well implemented, because this the normal workers, they cannot go direct maybe to the CEO. They have to report to the manager, and then the manager reports to the top, to the top management. So, but also another way why managers are very key in planning and implementation, because these managers, they are the ones who knows the operations of the organization, of any company. If it's the factory, any workplace, they know how the machine operates, the system, how it operates. If workers are working on shift, the managers, they are the ones who knows that. So you cannot keep away these managers. So I can summarize like health and safety management system is not a work of one person. You cannot just say I'm a health and safety manager of a certain company, so I can do everything. You cannot do everything. It has to start from a normal worker to the supervisor to the manager. Then we go up to the top levels. But also the risky assessment method. Any company must have a risky assessment in place. And if I have my fellow safety and health experts in the room, you can help me. You can back up me. You cannot prepare a risk assessment alone. It has to be a team of of experts. If you are working maybe in a pharmaceutical company, it means you have departments. You have warehouse maybe department. You have maybe quality control department. You have maybe production department. You have maybe engineering department. So from each department, every department has maybe its own activities. So you cannot just sit on the table and say that I've prepared a risky assessment. You have to involve both departments so that you can come up with a tentative, a very good risk assessment of the company, that you have touched every corner of the workplace. But also on the risk assessment method, it will help to decide priorities and set objectives for hazard elimination and risk reduction. So it is very, very important to have a risk assessment in place. So if you are working in a company and you don't have a risk assessment, you must have it. It is not a very difficult thing to do. It can be done. But also through risk elimination, it can help to design facilities, equipment, and policies, or use of physical control measures. Through a risk assessment, it can help you to know the activities that are in place, how risky are they, and what are the control measures that you can put in place. These are the risk assessment approach. If you do a risk assessment, we normally have these methods, these control measures. The first one is you have to find a way of eliminating a risk. That's number one. But if it's not possible to eliminate a risk, you can find a way of substituting it. Then we come on the engineering controls. The engineering controls now, if it's a new workplace area, the part of design now comes in place. And the administrative control is the last approach. And the administrative control here is the last approach. On the administrative control, we can now check on the SOPs, the trainings, and all that. But the approach must be elimination, substitution, and engineering control. Next. Now, I would like to ask the class, you can see we have two different areas, one working at 8 and another one working in the warehouse. They are handling a chemical. So can anyone tell me, let's start with the chemical handling activity. Can anybody tell me what are the hazards associated with chemical handling? What are the risks associated with chemical handling? But also, what are the controls that can be put in place, as I've explained on the last risk assessment method approach. Class.
Yeah.
Hello.
Hello. Yeah.
Can you just raise up your hand if you have an answer or anything to contribute on example?
Kindly raise up your hand. When you raise up your hand, the trainer will call you, okay? Thanks. Mr. Nudeko. Yes, Mr. Nudeko first.
Hello, you can proceed. You can proceed.
We can't hear Mr. Nudeko right now. So let's ask Mr. Okoli. Later, Mr. Nudeko will come back, right? Mr. Eric, we can't hear you now because of your network, right?
Hello.
Yes, please,
hello,
Mr. Okoli. Yes.
Hello, everybody. Can you hear me?
Yeah, we can hear you now.
Okay. The first picture, we have a container containing chemicals, being driven on a pulley system. So the hazard we can see there is the chemical in the container. And we can also say the machine itself, which is the pulley, it's also a hazard. Then if you talk about the risk, we can say the poisonous substance, which is the chemical, can cause maybe how do we say, pollution, air pollution, or maybe cause hazard like sleep when it falls, Then you can talk about the risk associated with the pulley. While the man is pulling it, his hands can pull, or maybe he can fall, maybe trying to pull the chemical. Then the other picture, what I can say is the man is working from height. Even though he has a belt attached to himself, there's every chances that he's exposed to the atmosphere, and anything can happen to him, like maybe fall. He can equally fall, and which other risk can I talk about? It's minimized anyway. So the hazard itself is maybe him walking from height, and then maybe the belt system is using, it could cut. So the belt itself is hazard, So, but he has the right PPE in place from the picture. So he could fall, and casualty, maybe any damage can happen to him or injury can happen to him while working from height.
Okay. I have a question, sorry, on top of your explanation.
Yeah.
So on the chemical handling, how can we eliminate, because I've just explained on the risk assessment approach, elimination, substitution, engineering controls, and administrative. So can you just tell me how can we eliminate the risk on the activity of chemical handling?
Yeah, one way we can eliminate the risk, maybe according to the way you've explained, or it's self-explanatory. If we substitute, we can change the pulley system with maybe with a truck, or maybe with a system that can be able to hold the what's it called, the container in place so that it doesn't fall or it doesn't injure the man that is doing the work manually. It could be done with machines, so that the effort put in pulling the chemical does not cause any harm or injury to the worker.
Okay, and on the engineering control?
Engineering control, well, maybe we look at a way we can attach maybe something like a belt to the container, because from the picture we can see that there wasn't anything holding the drum to containing the chemical to the pulley system. So if you can put that engineering aspect of it, then it can be able to hold firm the drum to the pulley. So
in that administrative
way, yeah, the administrative aspect of it, maybe we can talk about identifying all the hazards of doing such work before even carrying the chemical. Then if we see it, then we try to analyze the risk. Then if we see that it could cause harm, then we can look for a better way to carry the chemical from one place to the other. So with little knowledge I have, that's what I can observe.
Wow, that's really good. Let me just add on what Mr. Kenneth has just explained. On the part of engineering control, this is a warehouse. So during construction, they had to make sure that it has enough ventilation. That's part of engineering, right?
It has enough what?
Ventilation, because it's a chemical area room.
Okay.
So so the storage conditions basis on the engineering. So we can go on the HVAC. If you have an idea of HVAC systems in place, make sure that the temperatures and all that, because if we have a warehouse, maybe these chemicals maybe are flammable. If they're stored in a temperature which is not required for storage, it means it can result into what? Explosion and or other things like that. But on the part of administrative, now is to make sure that we have standard operating procedures in place. These workers are aware of procedures of handling chemicals. I mean, maybe hazardous chemicals. Are they aware of them? Maybe they may be not. I mean, the procedures might be in place. If there are trainings in place that to make sure that these workers, before handling the chemicals, they know all the proper procedures to follow before handling the chemicals. So in a nutshell, that's how I can explain it. But also make sure that they have all the required PPEs. That, as we can see, they have overalls, they have the face shield,
And
they have
gloves.
safety shoes, they have gloves. So
Yeah.
all those are just administrative. Yes. Yes. Are we together, class?
Yes,
We are together.
yeah, we are.
Yes. Can you go to the next slide, please?
Explanations are comprehensive.
Sorry?
Yeah, you can move on, please.
Now we are going on the part of evaluating, monitoring, review, measurement, and investigation. So any health and safety management system must explain in detail on how evaluation can be done, monitoring how it can be done or it will be done, how review will be done, yes, and investigation. So this can be done through procedures to monitor, measure, and record health and safety on regular basis. So this is through audit. This can be done through, through review. So these procedures which are in place after creating, after developing a procedure or a policy, because we know, for example, today it is 2022, or maybe I can give an example of a company was started in 2002. But for today, when the company started, they developed different procedures, policies of how the company will operate. But today is 2022. If you can see the gap from 2022 and 2002, sorry, to 2022, there's a big gap. There is a change in technologies. New people maybe are coming in there. So many things have happened here in between. So if you will have a health and safety management system in place without reviewing it, that one, it can't work. So health and safety management system has to be reviewed because things changes, technologies changes, new machines are coming. Yes, so that's one of the advantages of doing a review. But also, if you do a review of your procedures, of the policies that are in place, it will help also to do continuous improvement, where to improve, where to add on, where to reduce, something like that. So, but if you don't do review, if you don't have a procedure, or you do not say how you'll be doing a review of your system, it will be very difficult to get a very good performance in health and safety. And another thing, health and safety performance to be measured against the predetermined standards. This one can be done through implementing different international standards. For example, for safety, we have what we call ISO 45001. This is the current one, but lately they are kept updated. So if you have health and safety performance to be measured against the predetermined standards, so we have these international standards, but we have also local standards. So through this also, it can help to do the performance, to do the review, the monitoring, and the measurement. Yes, next please. This I've already explained that through auditing, you can do the audit, which is internal audit against the external audit. Internal audit is within the company, but external audit, you get other stakeholders outside the company, so that they can go through the procedures and the system in place, and they come out with findings. Then you set out the action plan on how you're going to improve on the ways. The audit actually helps to know the strengths and weaknesses of health and safety management system in place. Next, please. Now, this is another part on how you can implement health and safety management system. Employer has to be involved in health and safety management system. I think I've explained it in the very first beginning that employer is someone who gives work to others and pays them to do that work. So the main responsibility of the employer is to make sure that has a duty to ensure far as reasonably practicable, healthy, safety and welfare. So employer is the main key person who can make sure that the health and safety is well implemented. You cannot just come up with the system if the management does not understand you, doesn't know the advantage of having the health and safety management system in place. So the employer is a very important person, to help in implementing health and safety management system in any company or any organization. Next. Also, the manager involvement in health and safety management system. As I've explained before, that managers are often the key to health and safety culture of an organization, because managers are the people who are very close to the workers, these workers of lower levels, the operators, the cleaners. So the managers, they are key player in implementation of health and safety management system, in development of health and safety management system. And there is this culture. You find a person sitting on the desk and just Googling, like it's just taking things from the internet. But if you sit down with these managers, they have a lot of information about the system that is in the place. And for your information, any health and safety management system of company A and company B, they cannot be the same. Why? Because operations are different. If you talk about maybe pharmaceutical factory, and you talk about maybe mining industry, these are two different things. So you cannot find that the system in place, the elements and the components are almost the same, but the contents must be as per the activities or operations that are in place. Yes. But also the managers, they know the competent people in the company or in their department. But also these managers, they can help to easily implement the health and safety culture, because managers are very close to these normal workers who are exposed to the risks every day. So if the manager is aware, or the level of understanding of health and safety culture is very high, so the normal worker will just copy from the manager. But if the manager doesn't know anything about health and safety culture, it will be very difficult for you as a health and safety personnel to go direct and talk to the worker. But if there is this, I can say, you start from the manager, you come to the supervisor, come to the normal worker. So the work becomes very easy. Next. Now, how can we manage the health and safety? Managing health and safety is through planning for health and safety. So if you say health and safety management system, you must plan for it. You must set standards. Okay? Then you must implement the health and safety policy. If you said maybe we are committed to provide PPEs, you must do it. It is, and as I've said, that the policy must be cost effective. So you must make sure that anything that is stated in the policy, it will be very easy to implement. So it will be very, very surprising if something the company has committed itself to do something and it is not done, because during audits, the auditors, they don't normally ask the managers or the supervisors. They can just come to the normal worker Are you given PPEs? This and this. So they check on what is written against what is practical. Yes. But also organizing the employees in ways that they can implement the health and safety policy as part of their work activities. So now this is the work of the safety personnel to make sure that the level of awareness of health and safety within the organization or the company is high. So if people are aware, they have enough information about health and safety, it means the health and safety culture will be very easy, because health and safety is all about behavior in the workplace, all about behavior. And as we know that dealing with people is a very, very difficult thing. And for example, a person would like to wear his jeans while working, but the procedure says you have to wear an overall while working. So you can see it's all about behavior. So if you don't raise enough awareness, if you don't give them training, if you don't insist them every day, like the way we read Bibles and Quran, it will be very, very difficult to raise the health and safety culture in your company. But also another thing is auditing the whole health and safety performance. I've explained it before that. For you to know that my system is working properly, or I have a very good key performance indicators, it has to be audited. But also reporting performance to employers. This goes to the health and safety specialist. You have to make sure that you do the reporting performance. You report on the incidents, and incidents you start from near misses, minor incidents, major incidents, the high potential, all those small things, they have to be reported. The statistics, they have to be reported. You have done the inspection, I mean, maybe it's a routine inspection or those monthly inspection or non-routine inspection on safety, they have to be reported. So if you have such activities are being done daily, it means people will get used to it. For example, if you do just maybe if you walk around in the morning, you start, I mean, you walk around, you look like housekeeping, how is it, how the procedures are followed, and then you just have a summary, maybe a one-page report, and then you report it to the manager. So it means these, I mean, other workers, or if it's a supervisor, you'll be very, very active that if I do like this thing will be reported. So it is very, very important to report the inspections and safe observations. So these are the very, very important things to be reported to the employers. Next. On the planning and organizing an effective health and safety culture, it means through policies and implementation, as I've already explained. On the resources now here. Resources means you have to make sure that you have adequate resources, because, for example, on this part I can explain. If you are a health and safety specialist, you have to make sure that you prepare a budget, or mainly on health and safety only, so that the management is aware of health and safety requirement, so that the proper reallocation can be done. Because if you don't put a budget, like I need this subscription fees, I need this medical checkup fees, and I need budget for PPE, I need budget for external audit, if you don't put them, it means if you raise them maybe in the middle of the year, it will be very difficult for them to be implemented, because as we know, most of the companies, they have annual budget. So if you don't prepare it and present it to the management early, it means even if you have procedure in place that needs a PPE, needs what, it is not in the budget. So the budget has to be in place. If you're the health and safety personnel, you have to make sure that you check every point, like we need this, we need signages, we need to, all those stuffs they need to be checked. We need to take people for training and all that. So through that, it means that the management, we know, like we have this, we have to set this amount so that to make sure that we complete all this to get compliance, but also to make sure that the health and safety culture is active. Another thing is communication. I've already said that communication has to be a very key way, and the communication can be done through health and safety representatives. The flow is through managers, supervisors, and workers. Health and safety representatives also, they can help to make sure that the communication is well done, because this is very important. Why? Because you find a certain company, they're almost 1,000, they have 1,000 employees. So 1,000 employees, how can you communicate to everyone? So if we don't have representatives, health and safety representatives, it will be very difficult. You cannot communicate it to 1,000 employees. You see, so if you use these health and safety representatives, managers, supervisors, it will be very easy to reach even these normal, these workers of lower levels. Next. Now, on the risk assessment, I've already explained. Manager of health and safety is based on the risk management. And here, a baseline risk assessment has to be prepared. When we say a baseline, this is a report, or it's a report that contains all activities from those those activities which seems to be of high risk, and those activities which seems to be of low risk. In risk assessment, we tackle every component, even a cleaner. The risk, if it's on the cleaning activity, it has to be seen in the risk assessment. You see, so based on risk assessment, it explains all the operations in detail of every department, HR department, if it's production department, every department, if it's logistics, depending on the nature of the company, of the organization. So every point it has to be well tackled in the baseline risk assessment. So having a baseline risk assessment is like a roadmap, but during reviewing, it means the report will be changing. Maybe you had a certain machine of maybe low capacity, but now you've brought maybe a new machine. Now you have to review, because the risks, the hazards are different. Okay, maybe that had a low level of noise. This one has is high, is noisy than the previous one. So the risk the risk assessment report has to be reviewed. It has to be reviewed. But also, the managers must ensure that the system are in place to assess risk and implement appropriate controls. Already explained, managers also should receive monitoring reports from supervisors and make decisions. Yes, next. Next. Yes, on the part of reviewing health and safety performance, I've already explained it very well, that formal reviews of performance, they have to be done. Incident data, these are very important. They have to be done. This is one of the key performance indicators in any company. If you have incident, if you have like you have cases of fatal cases every month you have maybe fatal case. One employee has died every month. That is very bad. So those reports, they have to be sent. But also cultural issues such as prevention measures, training and maintenance programs. All these are through reviewing health and safety performance system. For example, you have maybe an operation, like what example can I give? Maybe, yes, maybe an operating machine. As you can all agree with me, if a company does not have a maintenance program, if you don't have a maintenance program, first of all, if you have a new machine, maybe its life expectancy is 20 years, but because there is no maintenance program, it means if you expected it to live for 20 years, it will be reduced to 10, because we know maintenance, they make the machine to be healthy, but also to reduce, because if you do if there is a maintenance program, it means to be very easy to identify any defects in the machine. So if the defect was not identified early through maintenance, it means it can result to a very big accident or very big incident. So it is very, very important. It is very, very important. And through audits, they normally ask, do you have a maintenance program in your company? So you cannot have machines and you don't have maintenance programs. And there's a big challenge that most of the companies, they have so many documents, but if you come on the implementation, they are not implemented at all. So having the documents in place, procedures, written documents in place is one part, but having implemented procedures is another thing. Yes. Okay, and the review, yes, working with contractors and consultants. As we all know that if you have maybe a company, it has 20 workers, you have maybe 20 employees, I can say. But now you hired contractors to work in your company. It means you were able to control 20 people. But now maybe you have 5 contractors working in your company as service providers. Maybe they're doing maintenance of certain thing, they're doing this and this. So it means the more you accommodate more people, the more you accommodate other people apart from your employee. I mean, apart from your employees, it means the risk will increase. So you also need to have procedures that explains in detail on how you are going to handle these contractors and consultants when they come to work in your company or to work in your organization. So it means you have to state it very clear. Most of the time, I mean, the very easiest way on how to handle these contractors or consultants is to take these consultants or contractors who have also health and safety management systems in their place, rather than hiring a company or giving a tender to a contractor who doesn't have health and safety management system in his place. So mostly, I mean, most of the times, health and safety management system, it is the responsibility of the contractor that when he comes in your place, he has to make sure that he abides with all health and safety procedures in which are in your place or in your company. But you have to train them, to tell them your procedures. They have to do this. They do not have to do this. They have to be, if they have come with machines, they have to be inspected, all those things. So you must have also a procedure in your place which will explain in detail that when you come to work in my company, you need to follow my procedures which are in place. Yes. Next. Supervisor involvement, I've already explained it. Next. Can you go on the next, please? Yes, now this is a very, very key, important thing on health and safety management system. When you talk about health and safety management system, it's all about record keeping. It's all about keeping records. If you have permit to work system, safe permit to work system, if you have it written, but you have no records that shows that procedure is implemented, on health and safety management system, we can say you have done nothing. If you have a procedure on incidents recording, but you have not, incidents have happened, but you have not recorded even a single incident. You don't have even a single incident report. We can say it on the performance, can give you zero marks. You have health and safety. You have said I'll be training maybe my workers, I'll be training so and so, but no training records. Maybe I'll be doing toolbox talk. So everything that is done, it has to be recorded. If you take maybe 5 minutes talking to workers about health and safety culture, you have to make sure that they sign the dates, their names, their departments, they put also the signature. And you can also go further. You also put maybe on the topics that we had discussed, then you just file it. You can also have a register of your competent persons, their CVs, their work certificates and all that. Maybe they attended training this year, next year they've attended another training. Those are the things that they make the health and safety management system to be active. If you don't record, if you do and you don't record, it means we cannot say the health and safety management system of a certain company is active. Okay, healthy surveillance records. You have done medical checkups of your employees, maybe pre-employment medical checkup, maybe periodic medical checkups or exit. You must have records. You must have records. If you don't keep records, it won't be taken as one of the performance indicator. So you must make sure that you keep all the records. Maybe you have employed a person 2022. When he came, he was very, very okay, and you did the checkup. When he left the company, maybe he had some issues. So if you don't keep records, it will be very, very difficult. Even if it happens that there is a certain case that you need to defend, it will be very difficult. So you need to keep records that when this employee came, he was in this status, now he's leaving the company, is in this status. So it is better for you, also better for the health of the workers. But also first aid records. You have first aid kits in the company. You may find that first aid kit contents, they are finished, but no any incident is reported, no record of how those first aid kit contents have been consumed. These, they have to be reported, because you cannot find maybe iodine tincture is finished, but nothing, no report of incident, no report even of a minor injury. So it means that you're not doing a follow-up. So all these, they have to be recorded. A fire plan or fire risk assessment. Maybe you've done a mock drill, all those, they have to be recorded. And written, maybe fire and emergency procedures, all these, they must be recorded. So record keeping is the one of the factor that can help to rate that this company is actively in implementing health and safety management system. Next. Sorry. Yeah, but also through record keeping, it can help to set the approved codes of conduct. All those, they have to be recorded. Health and safety executive publications. If there is any appointments, maybe you have appointed health and safety representatives, they have to be recorded. If you have appointed first aiders, they have to be recorded. If you have appointed maybe if you have given different awards, best, I don't know, safety, best employer in keeping the health and safety culture, they have to be recorded. So all of those things, maybe different standards and publications, they have to be recorded. If they are recorded, if you keep not recorded maybe 10 years back, but they have to be updated, recorded. updated, recorded. Today, yesterday, they have to be recorded daily. So that one, updated, record keeping of health and safety management system, it helped to make the company to be active in health and safety management system. Next. On organizing and supervising tasks. It means supervisors will help to implement the operational health and safety policy of the organization by overseeing tasks on behalf of the management. As I've already explained, that supervisors, they will help not to implement all health and safety procedures in place. Also, they will help to explain to new joined employees. They will help also to on the supervision of high-risk work environments. Also, it will increase on the level of supervision. Supervisors also to be involved in induction training for new joined employees, development and motivation. Like I will give you an example. Most of the trainings that I normally do, when an employee has just joined, a new employee, she or he has to be inducted. But also after sometimes you have these, what we call periodic trainings, they have to be inducted. So do an orientation, explain to that person this and this how they come, this is how the operations are done, these are the risks which are involved, and they have to sign. If we train them, if you induct them, they have to sign. Not only new joined employees, even visitors, all contractors, all those, they have to be inducted. If you want to keep an active health and safety culture in the company. Next. I think this I've talked about it during when I was explaining on communication, developing good relationships. It is very, very important. You know, safety is, I can say, is implementing health and safety management system. It is a bit tricky. Sometimes you do not need even to use much energy, no. But you need to make sure that you are a very good person in communication skill, in communication. Because sometimes if you want to know that, like, your health and safety, maybe your health and safety personnel, how can we know that health and safety management system in your organization is well implemented or is active? If you reach a level that maybe your health and safety manager, but you can be followed, you can be consulted by just a normal worker, that madam or sir, there is 1, 2, 3, 4 in our department. We have talked with the supervisor and the manager, but nothing is implemented. If you can win that you are the health and safety manager, but you are very close to these normal workers, it is very, very easy for you to even if you introduce a new thing. Maybe if the managers are busy, you can also go direct to the workers and they can just receive it very well and understand it and implement it. But if you boss yourself like I'm a manager, health and safety manager, and you don't have a good relationship with these normal workers, it means that they cannot be free to explain what they are facing on the part of health and safety, maybe on their working environment. It will be very, very difficult for you to do the implementation of health and safety management system. So it has to reach a level that these normal workers or workers, they see like you are as an angel, that if I go to Madam Safety or to Sir Safety, this issue of maybe not having PPEs or of this and this, because sometimes even supervisors or managers, they keep, these are just normal challenges. They don't do that much on following up. So you find if you are very close to, you have built there is no gap between you and these workers. You can interact with anybody, with normal workers, with the managers, supervisors, and the management. So it will be very easy for you to handle conflicts. It will be very easy for you to have even if you bring in a new thing, it means people will understand it very easily. You want to use much energy. Are we together, class?
Yes, please.
Yes.
Am I too fast?
No, your speed is okay. Go ahead.
It's okay. Okay. So on the issue of developing good relationships, it is very, very, very important to make sure that there is no gap. There's no gap from the lower level to the top management. So this will be very easy in implementing anything concerning health and safety management system. Sometimes you don't even need to feed them everything. You just need to hear their concern. What are you facing? What are your problems? Is the working environment okay? What so and so and so? What can, sometimes it's like you seek advice from them. It's not that if maybe you're educated, because we know in the organizations we have different levels. Some are educated, some are just casuals. So it doesn't mean that if you're highly educated, the normal worker cannot advise you. Sometimes because they are the one who are exposed daily to the operations, they can just give you advice. Madam, we can do 1, 2, 3, and 4. So if you take the advice of a normal, of a normal worker, adding on with your higher education, it means you can come up with something very, very tangible. So it is very, very important to develop a good relationship. Yes. Next. Next, please. Yeah, employees and other stakeholders. As I've already explained, employees and other workers, also they are very important in make sure that implementation of health and safety management system is active. As I've already explained, if you have new people, you have to tell them, this is my company, this is my organization. You have to abide with the 1, 2, 3 policy. You have to do 1, 2, 3, 4. You have to be inspected. You have to be trained. You have to be, so you have to introduce to them. You have to tell them everything. And voluntary workers, trainees, or experienced students, contractors, members of the public, and all these are just other stakeholders who can be affected by the activities that are going, are taking place in your workplace. So if they are new and they are not explained, like if you step there, you will get 1, 2, 3, and 4. So it will be very difficult for you to prevent incidents, because most of the time, some of the incidents are just lack of information. They are not aware, like if I step there, maybe something will happen to me. But if you train them, like, don't pass this road, don't do this, don't do this, they'll be aware. Next. Yeah, also safety representatives I've already explained. And on the safety representatives, we normally mix. If you appoint safety representatives, do not just select those managers or supervisors. No, you can just go to these normal workers who they don't have even any title, but they are the people who are directly exposed to operations every day. So these people, if you use them as safety and health representatives, they can give you information based on what they are practicing every day. So safety representatives, they must be also a competent person. They will help you in inspection. They will help in reporting accidents, but they will represent the employee. They will be representative of employee safety, but also they will be part of safety committee. In an organization, for the health and safety management system to work actively, you must have a health and safety committee. Health and safety committee involves workers, involves safety representatives, involves supervisors, involves managers, involves also the top management. And some, if the operations, they involve maybe 50% of the contractors, you will have also few representatives of the contractors or consultants or security department. Next. Yes, laws and responsibilities of safety representative I've already explained. They will help to identify hazards in the workplace that managers could not see. They will help in investigating complaints by employees about health and safety issues. They'll be consulted by employer about health and safety welfare issues. They will help to represent employees in discussions, because if you have 1,000 employees, you cannot just gather them and tell them to explain their issues on the health and safety concerns. But if they are representatives, so you can just select a few of them who will be representative of many. But also they'll be attending meetings of organizations, safety committee. They will also to investigate notifiable accidents or cases of diseases or health and dangerous occurrences. So these are the roles of safety representatives. Next. Yeah, and the representative of employer. Representative of employer, I mean this health and safety representative. They will also assess of information, inspection, consultation, also in good time. So all these things, they can be done by the health and safety committee also. Next. Safety committee is made of management, managers, supervisors, safety representatives, and other workers. So if you have at least one from each component, as you can see there, it means you will have a very good safety committee. It means you will have a person to speak on the part of management. You have someone to speak on part of managers. You have someone to speak on position of supervisor. You have someone to speak on position of safety representative. You have someone to speak on position of normal worker. So it means having this, even if you're discussing anything or you want to implement anything, to be very easy for everyone to talk, depending on the level or on the department he or she is working on. Next. Yes, now the safety committee, it can help to review statistics for accidents, maybe notifiable diseases, safety audits. Safety audits, the safety committee, they have to be involved. It will help to improve health and safety welfare measures. It will help to consider safety representative reports. Also to consider enforcement officer reports. But also it will help in cooperating with the enforcing authority. As we know that every country has their enforcing authority on the health and safety part. So they will help to make sure that you get compliance. But also they will help in developing safety procedures, because they are the one who are in operation in different departments. Next. But also they will help to monitor the effectiveness of the employee training program, to monitor the effectiveness of employee training, to monitor and review the health and safety information and publicity being provided in the workplace, to review the risk assessment, as I've already said, to examine the safety audit reports. So all these are the functions of safety committee, the health and safety committee. Next. Working together, as I've already said, health and safety management system cannot be implemented if there is no unity. So working together is the main key of any active health and safety management system, because health and safety is not a work of one person, it's everybody's responsibility. And nowadays, like in our country, it has gone far that if you employ someone, as you give him a job description that your work will be to switch on this machine to make sure that you record the temperature, you do so and so. Also on the job description, part of occupational health and safety, it has to be stated in the job description that once a person is employed, he has to know that health and safety culture is part of my responsibilities, part of my job description. So working together will help in communication, consultation, involving employees, motivating employees, will reduce fear, will help to opportunities to different issues, will help in incentives, will help in training and continuing professional development, outside help, this handling conflicts, working with enforcement officers. So if there is a teamwork, it means all these things will be very easy to implement. Next. Thank you so much for listening. That's the end of my presentation. If you have any question, please, you can ask.
Before they could ask their question, permit us to congratulate you or to show appreciation for your wonderful delivery. Not only wonderful delivery, but your precise and concise presentation. Well, some of us were not here while I was saying the introduction that if you come to understand this course clearly, it will help you to understand the following course like course 105, course 106, even course 108. Because here are the roots. Many concepts have been explained here. So if you are able to understand, it will help you to assimilate those courses as you reach them. But before that, I know there must be question. Thank you very much for a job well done. As I said earlier, she's one of the princesses in the team, along with we have only one queen, so she's the princess managing the safety affair. So thank you very much. Before I open room for question and answer, permit me also to say that if you have not received the presentation, probably check your mailbox by now. The secretariat have forwarded them to you. On the first day, it's true that we started because of unforeseen occurrences. We started late because of network issues. So the presenter on that day was asking something very important, but sadly, at the end of the session, do we have course? Now, this is an opportunity for him and for you, because if the foundation is well laid, it will help us to be strong, firmly uprooted. So I don't know if he's around, Mr. Richmond. Let me quickly check. If he's around, I'll give him opportunity. Then I'll give him opportunity so that he can deliberate. Then the point he wants to drive home that day can be clearly understood to each one of us. Besides, if you have a question, this is the time to raise up your hand. We call upon you to ask your question, and together we're going to bring solution, because we still have above 30 minutes to spend here. Nevertheless, as for few reminders, if you have not yet submitted your read data, your references like your surname, your middle name, whatever name you want to appear your certificate, your phone number, your email to the secretariat, kindly do so. It will help him to compile things as we are moving forward. Let me remind you that this is the day 3 of our series of masterclass. So if you do not have questions, me, I'll ask questions.
Hello, Mr. Leon.
Yes, please. Okay, you are around. Okay, thank you very much.
Yeah, I'm having problem with my network, so I'm using
no problem.
Samis this thing. We are both using it, so
no problem.
That's okay.
Okay, thank you very much for answering. Now, please, a little bit precision. We are in the official class, and things will be taking place properly. So what I want that we want to display best practices. If someone ask question, for example, if you have direct question, if you are opportune to answer first, give the direct answer so that all of us can have a clear idea. For example, when I say, why did you do this? I am expecting to hear that I do this because. So the first answer should be the direct. Then they help each one of us to be on the same level of understanding. But if I say, why did you do this? And you start from A to Z before coming to the answer, it might not be well understood to some of us here. So this is one of the best practices we want to implement. So Mr. Richmond, I'll come back to you. That is your question. The question was about day one, when we were in the foundation. We're trying to ask someone, a particular person, about, though the question was not a private matter, but we want to drive, probably you have a point you want to drive to safety. So I'll give you the floor now since we have no question. Then you clearly stipulate what you want to know. Then anyone who wants to answer will raise hand and we started, right? Can we move on?
Yeah, Mr. Leon, as the person already asked the question, or you are now asking for questions to be asked?
Okay, now let me explain. On Monday, we were trying to ask someone about his preferences about his woman or something like that, and because we were running late, we were not able to clear
Okay,
that.
okay,
Yes.
okay. Don't worry, I get you. But you know, I was just trying to conclude my presentation with an eye opener because I said a lot of things, putting it in a very narrow and easier way. I normally use this as an example or explanation, and normally people are able to catch it very fast because it's something that is part of us. No male or female who is of age, even those who are not of age, like our children, are even into it. When they see the opposite, they have that attraction. So once you have the attraction, what comes into mind?
So the question is once again, what comes to your mind when you see, or when a male sees opposite sex or a woman sees opposite sex, right? Is that the question? So that you can come to your conclusion, because we are interested in the safety point. Oh, you are muted. I'm sorry. You are muted. Let me unmute you. Please, sir, you can unmute yourself from your end. I'm trying to unmute you, but yeah, okay.
Yeah, I'm saying I'm not asking question this time. Okay, because my section is over, so I'm just explaining the conclusion to cut the long story very short. So at the end of the day, what comes into mind? Somebody will say, what comes into play? Now, once you see the opposite sex, you have one. The first one is the attraction. When you get the attraction can be the color of the person, the size of the person, the height of the person, maybe, yes. Then the next stage is now to go deeper into it. And that is where the answer is. Because the first one is very visible. You can see it. You can see that the person is black, the person is white, the person has chocolate color or whatever. The person has a short hair, long hair. The person is short or tall. You can see all these things, okay? But the second stage, that is where the problem is. You try to imagine certain things which is not visible, which you cannot see with your eye. So in safety, wherever you find yourself, you can see your chair, you can see your table, you can see your light, you can see your fan, you can see your air condition, you can see everything around you. But the second aspect is all these things you are seeing around you, what danger can it pose on you? Because they are all hazards. So they are all hazards. What are the risks involved in all those hazards around you? That is where you have to think. So now, I've seen Madam Peace, okay? And Madam Peace has attracted me. The next stage is once I look at Madam Peace as she's coming towards me and I'm looking at her. When I look at the facial expression, I'll try to examine the breast in my head. Is the breast big or small? Is it the type I want? Is it hard or soft? You try to imagine these things. Is it true or false? It is something that we all do it. And you, Mr. Leon, will attest with me that in the previous classes, they all attest that I mean, even I don't say it, they have been saying it themselves, which means it is true. You are not seeing the thing, but you are just imagining how the thing is. So if I should take Madam Peace to my room, am I going to see it as it is, as I am imagining? You get it? So in your analysis, you try to imagine that what danger can the table impose on me? What danger can the chair impose on me? And if that danger imposed, what are the implications? That is the severity and the consequences. You get it? So you try to imagine all these things. And you remember one lady said when she sees a male and the male attracts her, then the second stage is she tries to come to the waist level and see the kind of pistol the person is using, whether it's AK-47 or bazooka or whatever. You get it?
Very much.
So that is what we are trying to bring on board, that as a fundamental stage, your eye needs to open on a lot of things. Don't close your eyes to the things around you, but your eyes must be open to the things around you and dive deep into it. Dive deep into it. What are the risk level? What are the severity? What are the consequences? Based on that, you can have controls to mitigate or eliminate the levels to bring it to acceptable level. So thank you.
Thank you very much, Mr. Rismond. In fact, if I bring this one, it will reassure everyone that he was not he was not trying to intrude to privacy. The point is that we want to know the apparent causes and the real causes, and most of time the real causes are beyond the surface. So this is the point. In safety, we will look beyond the surface. We go deep to the root causes. So thank you very much. Even your explanation was very clear, and your illustration. I can see Madam Peace is really beautiful, and she's really attractive. Only her cloth does not make me to see the type of breast she has. So thank you very much. This is what I want to assure everyone, that because some might feel it that he was intruding the privacy law. This is an illustration that has been effective several times. So in safety, always try to look beyond the apparent causes, look for the deep causes, look for the root of the matter. It will help you to assess the risk. Thank you very much. So I want to assure everyone that he was not going over his perimeter. In fact, he is an expert trainer and he knows how to catch our attention. Thank you very much. Now we still have a lot of time. Now, if you don't ask question, me, I'll ask you question, because this is an interactive session. If you follow, if you have question, raise up your hand. You have opportunity to ask before I continue. In this course 103, a lot of things have been said that should be really interested. Yeah, Mr. Nura Abu Jafar, do you want to ask a question?
No, I just unmuted myself so that if there is anything, I can be ready. And
You can mute yourself. Once you have a suggestion, you can come in, right? So
it's okay, thank you.
Yeah, if you follow Miss Prudenciana, she said that when it comes to draft or when it comes to making the safety policies procedure, that you should be involved. You should be involved. Not someone else will write a procedure on your behalf. What does it mean? What does it mean? Is the direct question I'm asking, and I want answer from you because you were really precise in her presentation, and I know that you have the presentation beforehand. What does it mean? Because we are here as a safety professional, we are here as a safety managers, and our aspiration is that we become manager, or even we become we become manager. I would prefer manager than employer. Because when we are effective manager, it helps us to understand the deep cause of safety culture. Yeah, Mr. Okoli Kenneth, you can unmute yourself.
Yeah, well, from what it means is that once there's a safety culture in place or a safety procedure in place, I have to be involved in the process of drawing up a safety management system, because it's the safety is about everybody. Everybody is involved in safety from top to bottom, so it's inclusive. So when one part of the management system is missing, that means it's not complete. So it's not a good safety culture in place. That's what I feel.
Thank you very much for your well-meaning answers. That is it. Do not forget that.
Leon, can you hear me?
Yes, please. Okay.
Leon, can you hear me?
Yeah, Mr. Nudeko. Yeah, Mr. Nudeko. Okay. Go on.
I hope you can hear me now. All right.
We are listening to you
so,
now.
I think my involvement is also very much needed, because by then I see myself as a safety manager, and everything around me is hazard. Therefore, my being part of implementation, risk assessment, and giving my word is to make sure that with the knowledge I have, I want the company, the organization, or people that are in it get the best of the safety understanding. So my presence in that sitting or in that meeting will be very much useful, because I've acquired enough to push safety and its health information forward to the table to be implemented.
Thank you very much. This is the real truth. Yes, all of you, your answers are quite correct. You know, who are the first subjects of a safety policies? Are they not the operational officers? That is the people who are active in the field, the people who are operating the machinery. Now, if you do not get yourself involved and someone else drafts something and impose on you, will it be effective? The answer is capital no. So the point I want to drive home here, sadly, in some companies, when they ask the managers to bring, now the term have been changing, we talk of approaches of solution. When they ask them to bring approaches of solution, approaches of input, some of them, based on their experience, they lock themselves in the office and start drafting or start carving from what others have done, like international standard. They carve from it on paper and they go and submit without going down deep from the layman officer to ask for his input. So normally, as Mr. Okoli answered, that it should be from top to bottom and from bottom to top. You go back to the operational officer and you ask him, the first step, you ask him, how is this one done? How did you operate your work? And you listen to him because he has acquired experience on how he used to do it. You listen to maybe his approach is the best than the one you want to carve out from a document and paint. Then you listen to keep bring his input. From there, you go again to the supervisor. Then you ask the supervisor his approach. The supervisor gives you his approach. You as the manager also, you have your approach, and because of your experience, that's why you are manager. Then you do what we call the synergy, the symbiosis. From there, it can help you to have something that is adapted to the reality of your company. You know, during our audit, sometimes we do see a well-documented procedure that are not effective to such a company. Here, have seen it several times. People have a well-painted procedure that were adapting to a bigger company. And because they don't want to have a procedure, they put word by word, sentence by sentence, and it's not effective. So therefore, my point is that in your respective company as manager, please always consider the viewpoint of your subjects. Always ask of their input. By asking for their input, you are making the work easier for yourself. By asking for their input, you are adding to the wealth of your experience. Do not minimize them. Always take into account. Even you can ask them, please, can you operate? Let me see. Then from there, you see if it is effective. Now, in the new approach, while drafting the policies and the procedure, it's stipulated that you ask the auditee, that is the person you are asking, which approach of solution do you think is effective? This is where we talk of the 3E, efficacy, effectiveness, and economic. So when you ask them, you listen. So you have a lot of work on this aspect. And in this bar, we have a lot of professional workers. I presume that you have been doing this. Please, this is an opportunity to commend you for what you are doing in your respective environment. But please take this into account, because the reality is completely sad that people, when you ask the direct workers, even they don't, sometimes they are not aware of the changes or the amendment of the policies. Whereas policies supposed to, and you ask them to obey the policies, so they will just be just for obeying sake, or you just ask them to follow for following sake. So please always ask for their input. It will help you to have a strong policies and procedure. And most of the time, if you call external consultant, because she mentioned external consultant, now in the modern day, consultants are becoming smart. When they come, they come from what you have. Do not expect them that they'll bring something elsewhere and to come and glue to your organization. No, even if you pay them, they'll always come from what you have as roots. This is how they work easier. And we say that practice makes efficient. Yes, somebody is raising hand. Mr. Okoli, yes, you can unmute yourself to contribute.
Yeah, once more, I want everybody to pay attention to what I want to say now, because it's a practical example from the lectures I received yesterday. So it was a wonderful package, which has helped me a lot where I work. So today I confronted my line manager because I'm a security professional, you know, so I'm not a safety person. So though I have a lot of idea in safety, and where we work, I work in a manufacturing company. There's a lot of safety issues I've been able to see now, because as a result of the course I received yesterday, which I never knew was in place. So, you know, we work 24 hours. I work 24 hours. That means I work today, then tomorrow I don't work. I work the next day. I don't work the following day. So I work 3 times a week. So that 24 hours covers that I must work from morning till the next day. So, and working from morning to the next day means that sometimes as a supervisor, I'm involved in logistics movement. You know, you move valuables, which are very expensive, and it attracts a lot of risk, you know, as a result of theft or damage or attacks. So sometimes we move very odd hours. Sometimes we move 11 o'clock in the night, 12 o'clock in the night, 1 a.m. We move like about 30 kilometers, you know, with these valuables. So I went to my line manager yesterday and I was trying to tell my line manager, I mean, have we tried to consider the safety aspect of moving in the night? You know, you are moving from Lagos to Ogun State, you know, moving valuables. So what are the safety people doing? Because we have a safety department. Is it that they are not aware of this risk? You know, so to bring it down to where the point I'm trying to raise, you know, they are trying to cut corners because that very aspect of job I'm doing is so important to the organization that they are trying to meet target. So in trying to meet target, they are cutting corners. They don't want to consider, you know, moving that night movement, where sometimes some of these trucks, some of their safety parts, like the headlights, then the road itself, then area boys and all the, you know, all the dangers you meet in the road. Management don't want to put it in practice because I've raised it. And what he's telling me, there's no way they can, you know, prevent it. There have been an incident whereby we moved around 2 a.m. and the truck, you know, damaged on the road, and there wasn't help coming from any quarters. So we're exposed to such dangers that we have to remain there until in the morning when it is bright before mechanics were able to come and resolve that problem. So I wish the lecturer is in place today to listen to me. He can tell me what I should do because I consulted the manager today. Why is it that we have a safety department in the company and they should be aware of this risk and they continue to expose the workers to such a risk, whereas they don't have any guarantee for maybe insurance policy that covers that aspect. I don't know if you understand what I'm saying.
Yes, I follow you intently.
So my security manager is telling me there's no way he can be able to discuss that with management because I'm challenging him. They have to review it. He now asked me what can be done. I said, what we can do is that, you know, to minimize the risk, why don't we work from morning, it's okay, till 10 o'clock in the night, because this travel is between 1 hour and 1 hour travel, 1 hour, 30 minutes travel between where I work to Ogun State. So why don't we stop work by 10 p.m. and then maybe resume maybe around 4 p.m. so that even though there's damage on the way, it's not that middle in the night. Okay. We can be able to call in the mechanics. And then, you know, because of high risk of the valuables, it costs a lot of million. One single truck or equipment we carry is worth more than 80 million. So, and some of these criminals, if they know the value of what you are carrying, then you could be attacked. So that means for all the years I've been working in the organization, you know, safety has made me to understand that these things we are doing is high risk, and the safety department, probably they know about it and they are cutting corners because they want to meet target of production. Thank you.
Thank you very much for your very nice explanation, and it can serve as a case study. But you are bringing part of the solution already, if you permit me to continue. You know, he asked you, what did you suggest? This is the very first point. You know, remember that in any organization, I talked earlier about the 3E. Any approach of solution should be based on the 3E, that is efficacy, effectiveness, and economic. So if you offer any suggestion, and by the way, it's good that you have a discussion with him, but what you did is informal. And he told you that he cannot defend such a point in the management because it was not documented. Our lecturer mentioned it right now that everything should be documented. You know, when we talk with document, we talk with power, we talk with authority. If a document, all those reports are like a holy writing, like Bible and Quran. When you see somebody quoting from Bible, and you know that he's quoting from Bible, you know that he's not the one speaking, but he's speaking from the authority of the Bible or the Quran. Likewise, anything documented when it comes to safety and health procedure, it helps people to see the veracity of what you are saying. Someone can challenge you by saying that the point you are saying is for your own profit. So if they do not know how valuable your proposal is, no one will support it, even if it is the best one. So the first point, you document it, that you mention the risk, the hazard, the risk associated with it, and the people that will be likely be harmed, and the gravity, the severity of the risk. Then it will help them to analyze by using the 3E, effectiveness, efficacy, and economic. Because if these three are not met, some will turn down your proposal. So the first thing, you write your thing down. What you notice, you write it down. You can write in your own word. Then you give to the safety department. But what you said that you assume that they know. In safety, we don't assume. We don't assume. We ask. Because assuming is a sin. Because as you are saying, you assume they know, they too will say they assume you know. So in safety, nobody assume. We ask. So you ask them, you send your report to them, we see what we are experiencing. Then it is well documented. It will be a follow-up. Then in case something happens, if an external consultant comes, your documentation may serve as a leading piece, as a leading way to find solution. So to cut the story short, I'm happy that you bring this point, which means that you are an attentive listener, because you said that from the lecture of yesterday, we see what you want from each one of you to learn and to implement. So you pen it down and you submit to your line manager, because if it is not documented, no one will believe you, no one will approve what is there, even he cannot defend it. He cannot defend mouth to mouth, but based on document, it will be easy to defend. So this is the first approach of solution. Now, generally, when the question is asked, we ask the audience first to bring a approach of solution before we intervene. Now, who else want to contribute to Mr. Okoli's concern? If you can unmute, you can raise your hand, and we still have time. Yeah, Madam Fola Kunle. Fola Kunle, do you want to speak? Do you want to contribute, Fola Kunle? If yes, you can go on. Hope we are together. Are we together?
Oh, yeah, we are.
Okay. So who want to contribute? We still have time. We have 7 more minutes before we close. Who want to contribute from what the concern of Mr. Okoli? So which means you do not support him. You want your brother to fall victim before you come and help him. Yeah, somebody is raising hand. Engineer Higgins. Engineer Higgins, are you the one raising hand, or Stephen? Oh, okay, Stephen, you can unmute
No,
yourself.
I'm the one.
Engineer himself. Welcome, sir. Okay, you have
Thank you so much. Thank you so much. It has been a wonderful session, and I think we are really flowing in the program. As regards to this question, it's very, very critical. And I will advise Engineer Cody that there is need for him to ensure the necessary safety rules, safety procedures are being carried out at the course of his job. Because I can assure you that if anything happens, for example, them having an incident on the road, maybe the tire burst or the vehicle spoiled, and it's around 2 a.m., 1 a.m., and something happened, I can assure you that highest the company will do within 2 or 3 days, the operation continues. Operation continues. In some cases, even in a very critical operations or in a very critical task or project ongoing, some people will be assigned to still proceed to cover up his position and be able to deliver the client's expectation. At that point, the family will be in jeopardy and a lot of things will go wrong. So I think there is a question I always ask at the course of such a program. Sometimes I do, as I said, do you live to work or you work to live? Do you live to work or you work to live? So it's a very tough decision. Some people will tell you, okay, I want to live and work. Some people say, I want to work to live. So if we enter into that debate now, you find out that we may not even live here today.
Yeah,
but
we have only 5 minutes to go.
Yes, so it's a very critical situation. I have been in that kind of situation before when I was actually in the construction field. That was in Lagos. That was when Lekki is Lekki. My boss will carry us, we enter into lagoon and ask us to go and be doing raft foundation in a very muddy, very dirty swamp. So at the time when I got the good knowledge of safety, I have to always ensure that I don't follow other engineers to enter those swamp. Because once the boss comes like this, you will say, okay, go and see those boys. Because a lot of all these artisans, they do a whole lot of stuff without knowing the implications and the consequences of their actions at the work site. So, but with the little knowledge I have, I refuse to enter such, because you may enter such swamp and at the end of the day, you will be contaminated with so many things that you can, that may start reacting in your body in a long time. It may not be immediate. From what I knew about occupational health, I knew that that occupation at that time, that task, have a lot of health risk. The risk is high. It's not even an injury you will say, okay, look at the causeway. It may happen after some years or some months, and the company won't have anything to do. So it's a very critical situation for us to have good knowledge of safety so that we can advise. In some cases, if it's life-threatening, you have to allow the job to go for you to be alive. It's very difficult and it's very tasking, especially in this part of the world, Africa, where safety is not considered as first priority. In the Western world, where their brain is working very accurately and very efficiently, they will always provide the necessary rules, provide the necessary support. They know what to do because they consider the life of every worker. They see their workers as assets, not to lose them or allow them to be sick, to be absent at work due to sickness or the other. But in this part of the world, nobody cares. There are so many factors to that, but I think I will advise, with the help of this knowledge, for us to do the needful. If you notice the vehicle is not good, or you notice, you do your own assessment, you know that you are moving from Lagos to Abuja, that is 15 hours journey, and you know that this can go, you have to advise. Then if they have to force you to do so, you have to tell them, look at the consequences. And in case where there is such cases before, you have to report them accordingly. You have to report them accordingly. So in my own case, what I do then, I always have problem with the project manager. He's always want to do this, even the safety, whatever. I will say, okay, if you don't agree on this, can we have this agreement signed yes, let some level of agreement or some level of job procedures be approved. You have a copy, even if they don't implement it, let there be something on black and white. Very, very important. It's very, very important because your safety is very key. If you are not there to talk, anybody can talk for you. They can talk anything. That is the issue. It's very, very critical situation in jobs like this. And that is why, as a professional body too, OSHAssociation, this kind of situation is very, very much in Africa. And that's why we are trying to bring those that matters, decision makers, government, chief executives to start getting involved in the affairs of health and safety issues and getting some knowledge for decision making, because it's a matter of decision. It's decision. One decision can kill everybody and can collapse the system. One decision. So it's a very important thing for everyone to do a careful assessment, realistic one, and imagine the imaginable. It's not everything you say, God forbid. Everything you say is not our portion. Everything you pray. Even in the Bible, as Christians, the Bible made us to understand. It said, my people perish because of lack of knowledge. A lot of people have died at the cost of war. Christians ready to go to heaven have died due to foolishness, due to negligence, due to lack of these skills we are discussing in this class today. So they will die and go to heaven, fine, but they have lost to fulfill their destiny on earth. That is just it. That is what that quote means. So we need to have this knowledge. That is why the knowledge is meant to every human being to have this knowledge we are discussing here. But unfortunately, many people don't factor it very important. So that is a little I can say.
Thank you very much. Thank you very much, Engineer Emmanuel. And this is bringing us to the concluding part of tonight. This shows how vivid our class is, and tomorrow we hope to start from where we stop today. So a taking away point is that make sure that when he was saying that you should decide, it does not mean that you confront them. No, there is a way of negotiation. The lecturer mentioned that communication, good communication, you can state your point, very strong point, without heated discussion, without heated argument. So use a good communication. During the courses, we will learn deeply how a good communication, effective communication should be carried out. We thank you all, by extension, especially the trainer for this evening. You see how we are bringing our day 3 session to it, and tomorrow, by God's will, we're gonna be here and deal with course 102. Course 102 is one course opening our mind to the standard. So try to be there on time so that we can start. Thank you very much. This is the end of our tonight's session. You can unmute